Hi, I'm Tina, and welcome to Talking with Tina. Today we have a very special guest, Dr. Lauren Morris.
Hi, it's so nice to meet you.
Today, Dr. Morris will be telling us about the influenza A virus.
So the influenza A virus is an orthomyoxoviridae group virus, and it is an RNA genus virus. So the influenza A virus affects humans, and it can also infect animals like chicken, pigs, and ducks. And the part of your body that influenza A attacks is your respiratory system, or your respiratory tract. So it'll affect your nose, the tubes to your lungs, and your sinuses. And this virus can be spread very easily by whenever a person just would, for say, cough. If they cough, there are going to be particles that come out into the air that are going to have the influenza A virus, and then that will be taken in by other people in the room or in the area, which then can lead to them getting influenza A. Also, another way is just touching contaminated surfaces and not being clean, and then touching spots on your face like your eyes and your mouth, which are very susceptible for viruses to get into your system. The flu can cause things like sinus infections, pneumonia, and bronchitis whenever it's not treated right away or treated properly. Common symptoms that you're going to see whenever someone is to have the flu would be coughing, a lot of sneezing and runny noses, fatigue, and fever. And then there are ways to treat the flu would be Tamiflu, Relenza, Rebab, and Xfluza.
Is the flu a common virus?
The flu is a very common virus. However, there are very many ways to treat it to make sure that you don't get it or to prevent yourself from getting it. You can make sure to every year get a yearly flu shot. Go to your doctors. They'll give you one every time you go if you need it. And also just make sure you're always washing your hands, wiping down surfaces when anyone is sick in the house. And if you're starting to feel like you're getting the flu or you have symptoms of the flu, make sure to go and see your doctor so they can take care of it right away.
If someone were to have the flu, how would it be treated by a professional?
When you go in and you'd see a professional and they would tell you have the flu, common things they would say to you is to make sure you stay hydrated, because whenever you have the flu, your body becomes very, very dehydrated, and it's important to always stay hydrated to help your recovery move along. They're also going to prescribe you an antiviral medication to help with the virus, and then they'll also prescribe you over-the-counter drugs to make sure that your discomfort levels will go down, and then they'll give you antibiotics if and only if you end up getting a sinus infection as a result from the flu. However, antibiotics are not used or helpful to treat viruses, only some of the symptoms or things that can occur after having the virus.
For somebody who has the flu, how long is recovery?
So whenever you're comparing the flu to a common cold, the flu recovery process is going to take a bit longer. The recovery process for the flu is about 1 to 2 weeks, give or take, and depending on how strong your immune system is, depends on how long it's going to take. The stronger your immune system is, the shorter amount of time it'll take your body to recover, but the weaker your immune system is, or the more vulnerable your immune system is, the longer it's going to take you to recover. So if you're a child or a pregnant woman, it's going to take you a lot longer to recover from the flu, and it's going to be more detrimental to your life.
All right, folks, that's all for Talking with Tina. Thank you so much, Dr. Morris, for coming.
It's such a pleasure. Thank you for having me.